Today's FERN educational session involves critical long COVID symptoms, brain fog and headache, fatigue and weakness, and chronic inflammations. What are their pathologies, how to clinically diagnose these patients, and how to optimize patient outcomes. My name is Edward Sloan. I'm Professor Emeritus in the Department of Emergency Medicine at the U of I in Chicago, and I'm Medical Director of the PA Studies Program at Dominican University in River Forest, Illinois. I am FERN President and Board Chair. I have no financial conflicts. You can find this information on our fern.org website and our YouTube channel at fern.org. This is a screenshot of our playlist page. I encourage you to go there for more neurological emergencies information. This is my contact information QR. It is also important to note the public health information and advocacy efforts in patients or for patients who are sustaining long COVID symptoms. The National Institutes of Health, NIH, provides information, and there is information from the NIH, NHLBI, that provides research and resources that directly address the symptoms of long COVID. The NIH, the CDC, Center for Disease Controls, and the White House all have published information that relate to the need for patients with long COVID to receive optimal health care in order to improve their outcomes over time. Specifically for the CDC provides many resources that address the issue of long COVID, including reports that update our understanding of this disease and how it can be optimally managed. The 2022 CDC long COVID data said that long COVID is seen in approximately 7% of adults, 1.3% of children, which means up to 18 million Americans have or were sustaining long COVID symptoms. Those at greatest risk for long COVID symptoms include women, those with underlying illnesses, those who had initially severe COVID-19 disease, and those of Hispanic ethnicity. They note that the most common symptoms in long COVID patients are fatigue, brain fog, and post-exertional malaise. And they also note that the COVID-19 vaccine appears to reduce the risk of developing long COVID symptoms. The National Academies of Science also have published a monograph that addresses the issue of long-term health effects of COVID-19, including those symptoms we referred to or that are included in the description of long-term COVID patients. From the National Academies, the following conclusions are noted: that there are complex infection-associated chronic conditions affecting multiple body systems that are not new, and that long COVID shares many features with such conditions as ME, CFS, fibromyalgia, and postural orthostatic tachycardia syndrome, or POTS. This monograph also concludes that the current therapies about the pathophysiology of these conditions include immune dysregulation, neurological disturbances, cardiovascular damage, gastrointestinal dysfunction, metabolic issues, and mitochondrial dysfunction. The Academy suggests that more research be conducted in order to understand the natural history and management of this complex, multi-system chronic condition, which we call long COVID. These symptoms share many features with other chronic conditions such as ME, CFS. What about long COVID awareness and advocacy for patients with long COVID? One article in the San Francisco Chronicle identified the fact that long COVID and the occurrence of it in so many patients has highlighted what has been an ongoing chronic disease in some patients, ME/CFS. In other words, because these symptoms or disease states are so similar, we now have the ability to address issues related to both of these chronic conditions thought to be related to initial viral infection. What about POTS, the postural orthostatic tachycardia syndrome? There is an organization called Standing Up to POTS. It is dedicated to improving the quality of life for people with POTS through focused research, advocacy, and support. And the resources and community-driven programs that they identify hope that the issue of POTS, which is now in the forefront because it has occurred in so many individuals with long COVID, can help to identify ways to optimize the outcome in patients who have similar dysautonomia symptoms. Regarding dysautonomia, an organization called Dysautonomia International has a scope that includes diseases like POTS, and it provides support and advocacy for patients whose long COVID symptoms are a manifestation of some type of dysautonomia. And they have a network of both online and in-person help assistance that connects patients with similar experiences, offering guidance on managing these troublesome and hard to treat dysautonomia symptoms. Recover, researching COVID to enhance recovery, also addresses long COVID patient advocacy. There is something termed the Recover Initiative, whose goal is to make it possible to provide input in the care of long COVID patients so as to improve their outcome optimally. And in fact, the Recover organization or initiative has several publications which are identified on this slide. You can find these at recovercovid.org. So in conclusion, regarding long COVID public health information and advocacy, we see that there's information from the White House, NIH, and CDC, all of which expand patient and clinician awareness for long COVID as a disease. The National Academies has published a monograph that addresses long COVID, and there's advocacy related to ME/CFS that may apply to long COVID patients, and advocacy related to POTS and dysautonomias that are troublesome for many patients, including those who are post-COVID. And lastly, recovercovid.org supports research and recovery, and the Recovery Initiative publications support patient and clinician efforts to improve patient outcomes. Regarding long COVID patient physician action plans, here are some general concepts. It's important for clinicians to listen to symptom descriptions and reaffirm to the patient that these symptoms are real and have been noted in millions of other post-COVID patients. It's important to recognize that long COVID symptoms and those seen with ME/CFS and POTS are related. It's necessary, therefore, to delineate a multi-step approach. And it's important to tell patients directly that improvement is likely to occur over time. Therefore, patient assessments, both their own and by a clinician, need to occur over a longer period of time, such as at holiday intervals. In other words, you can't week to week determine whether you're getting better, but surely in between all major holidays, you can have an assessment that says, I am better than I was several months ago. And it's important to have the patient actively use the scientific method to help in their care. In other words, recording what symptoms occur on what days as a result of what activities or what interventions is an important way in which the patient can feel as though they have some control over this illness that we term long COVID. So patients can collect data such as experiencing brain fog, headache, fatigue, weakness, and any impairments to an optimal lifestyle. So what lifestyle changes can patients initiate with the guidance of their clinicians? It's important to optimize hydration and diet, healthy foods, low fat, low salt, low sugar. Vitamins and adjunct therapies also can be used as they may enhance the return to a normal life following long COVID. It's important to optimize medication use, whether these are pain medications, specific nerve-related meds, or SSRIs. Exercise and guided exertion and activities such as yoga may help with the fatigue and weakness seen in patients with chronic COVID symptoms. Optimal sleep, the use of naps, intervaled rest, and rehabilitation exercises all may also help patients as they attempt to regain an optimal lifestyle. Meditation, positive thought, faith, and fun, laughter, all of these may help patients as they try to recover from long COVID symptoms. Lastly, limiting the use of drugs, alcohol, and persistent time on screens looking at social media and other content may help with the mental health of patients who are attempting to recover from the physical and mental symptoms related to long COVID. The CDC specifically addresses lifestyle enhancements that can occur in patients with long COVID. These include how to pursue an optimal daily life when treating long COVID. These include ways in which pediatric patients, both adolescents and young adults, can deal with long COVID. The CDC also addresses issues regarding workplace efforts to feel better and perform better even when long COVID symptoms persist. The CDC also addresses visits to doctors and other healthcare clinicians in order to optimize that interaction, telling patients what might you expect, what might you ask, and how can you optimize this interaction with your healthcare clinician. The CDC also identifies support groups and resources that allow individual patients to join in with others to better understand their own disease and their own symptoms and the ways in which other individuals are dealing with it in order to optimize their lifestyle and their mental attitude regarding their treatment of this disease. And also, there are other resources that are available through the CDC regarding long COVID, as noted on this screenshot of one of the CDC's website pages. So in conclusion, regarding long COVID lifestyle enhancements, we know that there's information from the White House, NIH, CDC, all of which expands patient and clinician awareness. We know that there's an academy, National Academy monograph that addresses long COVID specifically. We know that there's advocacy related to ME, CFS that may apply to long COVID patients. And we know that there's advocacy related to POTS and dysautonomias that also may relate to those cardiovascular symptoms seen in some long COVID patients. The recovercovid.org site supports research and recovery, and we know that there are Recover publications that support patient and clinician efforts. Thank you for participating in this FERN educational session. You can find this video and others on our YouTube channel at fern.org. Have a good day.